Hello, I'm Stephen Ross Johnson, Population Health Reporter for Modern Healthcare, and welcome to our latest edition of the Checkup. The COVID-19 pandemic has been a challenging time for healthcare, both clinically and financially, as concerns over the threat of the disease has forced hospitals to limit patient visits that have led to revenue losses. As a result, executives have had to find new ways of reaching and caring for patients, which has led to innovative approaches some organizations are seeking to integrate within their operations for the long term. With me today is Dr. Imran Andrabi, President and CEO of ThedaCare, a seven-hospital community health system located in Northeast Wisconsin. Dr. Andrabi, thank you very much for joining us today.
Thank you, Stephen. It's my pleasure.
Let me start by asking you, what is your current situation in terms of how your organization is dealing with the capacity, staffing, and care delivery challenges being caused by the pandemic?
Stephen, again, thank you for having me. As you know, it's been a journey, and it's almost a year now since we've been in this pandemic in one way, shape, or form. I would say that it's been a challenging journey, and it's been also very gratifying to see how our teams have come together, innovating and creating new solutions as the different problems came forward. So very early on, we developed a incident command system back in January of 2020 to stay a step ahead of the game in terms of where this virus was going to go. That also then broke us up into different teams that were looking at inpatient capacity and what would happen with respect to admissions, hospitalizations, ICUs, and nursing capacity, and all the things that we needed to be ready for. And then, what we needed to do in terms of developing respiratory hubs, creating systems for people to be able to access information accurately and in a quick way to be able to get their symptoms looked at and the testing that was needed. And so we've gone through a lot of modulation early on with, having to stop, elective surgical procedures, as you know, that happened across the entire healthcare systems across the country. Then reopening, seeing a surge in Northeast Wisconsin. We were in the top 3 states in the country in terms of the number of cases. And since the end of the year, we've seen a steady decline right now in the number of cases coming into our hospitals. Having said that, as you also know, there is an emergence of the variants across the country, and that potentially creates a challenge with a potential for another surge that could come our way. So we are prepared and preparing for that, both internally and as we work with our partners in the community as well.
Now, in speaking with you before, I know that you mentioned that your organization, in terms of its population health management strategies, that it's been more of a journey that's spanned over a couple of years. Would you mind talking a little bit about how you got to this point in terms of your population health management strategies, and how did that previous work help you prepare for the challenges that you're facing now with the pandemic?
Certainly, that's a great question. So, over the last 2 years or so, we've been on this journey with the support of our board as we went in front of them and said, we want to pivot from being a traditional healthcare provider organization to a population health organization. And not to complicate the conversation, but what it really means to us is making sure that we are providing the highest quality of care every time, all the time, that we are providing the best access to the people in our community, and that they are having a tremendous experience with us every time they interface with us, and that we are ultimately creating affordability for the people in our community. The other thing that we know and have learned is the fact that we cannot be masters of everything that we do, and that we have to partner significantly, not only within healthcare, but outside of healthcare, to be able to bring folks together to create solutions. So as a result of that, over the last 2 years, we've done a tremendous amount of work, both internally with our physicians, our other clinicians, our administrative folks, and externally in the community with respect to going upstream and trying to look at social determinants of health. What are the other things that impact health and well-being? And during this pandemic, that work that we had done in cultivating those relationships and partnerships have been critical, including in the community. Without the help of our community partners, there would have been a lot of things that we would not have been able to solve for. For example, childcare for our nurses when the pandemic broke. For example, feeding people in the community that were not able to get out of their homes, and how to get groceries and other essentials to them, how to get pharmacy products out to those folks, so that they could continue to take care of themselves and be well. So those were several examples. We also partnered with a whole host of healthcare technology companies, and the one that I would showcase here is a company called Be Well, that we took their product as a platform that we had been working on before the pandemic, and actually accelerated the implementation of that particular platform, not only to help our own team members so that they could be on a platform, we could quickly get them checked in from a COVID perspective, any symptomatology, and connect them to our folks internally, so that if anybody checked in for a symptom that was positive, we could quickly get to them. We also did the same thing for the people in the community, and made that particular platform, which we call Ripple, available to the people in our community, so they could access COVID resources, they could access us, they knew where testing sites were, they knew where to go in terms of a respiratory hub if they needed it, and how to access ThedaCare much better. So I hope that all of those things that had been part of our journey up to this point actually significantly helped us accelerate our work during the pandemic.
And hearing you speak, some of the initiatives that you mentioned really get to the heart of addressing what we've called social determinants of health. Uh, Logistically speaking, how has the pandemic affected your ability to provide those types of services, address social determinants, and what do you think that you've learned from this experience that will influence how you address social determinants in the future?
Yeah, so that's another great question. I would say that going into this, I would speak for myself and hopefully for my team members as well. We always knew that social determinants were a big part of population health in terms of that journey. I think the pandemic has really put a focused light on the fact that you have to address social determinants, and that you cannot do this on your own, and you need a lot of partners who are not necessarily within the walls of the healthcare system. So, we partnered with the United Ways of the world, the Boys and Girls Clubs of the world, the YMCAs of the world, the Feeding Americas of the world, and 85 other partners in the community to really look at social determinants, figure out how to prioritize them, and then figure out solutions together. And then they were community-based solutions to the social determinants that impacted the health, both from a COVID perspective and also for those who did not have COVID. And I think those learnings and those relationships and connections that we've made are going to be things that we're going to take forward even post-COVID, because that'll help us accelerate our work in the community. We truly believe that 80% of healthcare is actually not only delivered, but determined outside of the four walls of health systems. And so this learning opportunity that we've had over the last year will really accelerate that process. So really happy about that. It's also been a aha moment in some ways to say, wow, it truly takes a village to take care of a village, and we are very fortunate to be part of the village that is so determined and committed to making sure that we do this work well. Another example, Stephen, I'd give you very quickly is during this entire process, we've had multiple community leader forums, almost 1 to 2 a month, where we brought community leaders together, had a conversation in a very transparent way about what the reality was, where things were going, showed them our modeling that we were doing, getting them prepared to be partners with us in the community and spreading the word. And in many areas where we provide care, getting that community together to actually activate the community made a tremendous difference in terms of our COVID volumes in the hospitals and the spread in the community as well. And then and one other example, if I may, is working with our school systems. So every week, we still till today meet with every school superintendent in our region, with public health, the health system, all coming together, listening to each other, understanding what's going on, what's not going on, and creating solutions. So one of the solutions, for example, we created with our school systems is mobile testing sites. So as we were developing testing capability in the community, it was difficult for them to send, either their kids and or the teachers to a fixed testing site. So we created a mobile testing site that we now take out to these schools, and we can test hundreds of people in a day and get that taken care of for them. So just a few examples of how we've learned and partnered in this process.
So, with that being said, would you say that your push towards community partnerships has you've seen an uptick in those efforts since the pandemic?
Oh, absolutely. And I would say it's been a critical success factor thus far for us to be able to be effective in the community and not only overcoming some of the challenges of COVID, but really setting us up for the future as well.
I wanted to change gears a little bit to ask you regarding last summer, your system and organization announced that it was undergoing a financial recovery plan that involved you taking a 50% pay cut and your executive leadership also taking substantial pay cuts. Will the economic strain caused by the pandemic have an impact on your efforts to employ population health management strategies in the future?
So we this was probably March or April when we found ourselves, like many other health systems, actually in a significant, I would say, hole. I don't know what else to call it, relative to where we thought we were going to be from a 2020 budget perspective. And so we made the decisions we needed to make at the time, for the basic reason that we wanted to make sure that as leaders, we set the tone to create an environment in which we could protect our people who were going above and beyond every day to take care of the people in our community. And so that was our fundamental principle, is to not lay off anybody, not to furlough anyone, and to take personal sacrifices, not only from a leadership perspective, but also our clinicians, i.e. our physicians, and took a pay cut as well to take care of the frontline staff. And I'm happy to say that we have been able to not only retain a tremendous number of people because we didn't let anybody go, but we've been able to recruit a tremendous number of people to ThedaCare in this process as well. Both clinicians, i.e. physicians and APCs, and nursing staff, and many others as well. In the meantime, we've also, obviously done a lot of other things that we could have done to mitigate against the financial downturn. And I think we are at a point now, looking into 2021, that we will continue to go down a solid path with our team members, who I'm extremely proud of, and continue to invest in population health the way we expected to back in 2019. It may have slowed us down a little bit, but I think we've also gained a lot of insights and learnings during this process.
What kind of role do you think that your population health management strategies moving forward may have in terms of helping you further stabilize the organization's finances?
So, Stephen, we are constantly looking at, how can we not only live in with one foot in each canoe, but try to take one of our feet off the one canoe and move more towards the other canoe. And that's a tricky transition. So a couple of things that we are constantly now thinking about is, what does that next business model need to look like? Who are the right partners who can co-think and co-develop that business model for us? How do we continue to move in a non-regrettable way down a path where there are certain things that we can do that work for us in fee-for-service and also work for us in the value world? And we may find ourselves partnering with folks that traditionally we would have thought as there's no way you could partner with folks like that. But that's what it would require us to think about, how to develop that new business model from a pop health perspective. So those are all the things that are on the table. And I hope that in 2021, we will reaccelerate our work from a pop health perspective in developing that model where our people are creating value every day, whether it's by improving quality and reducing cost from that perspective, improving access in our primary care, our specialty care, our diagnostics, our hospitals when they need to be there, and ultimately reducing the total cost of care. So I am not so enamored about the fact that I have to reduce this particular cost or that particular cost. But what I really would like us to do is to think about, how do we reduce the total cost across the continuum. So that's our journey. I don't have all the answers in terms of the hows, but we know where we want to be, and we are in the process of trying to figure out how to get down that path to create that value for the people that we serve.
Do you think that this whole episode regarding pandemic has in any way exposed some vulnerabilities within the fee-for-service pay model? And do you think that this might serve as an accelerant towards moving towards more value-based reimbursement?
Yeah, I certainly think so. I mean, I think we've learned that if we had stuck just with the idea of you only do things when you get paid for them, essentially, or the more you do, the more you get paid, as is in the fee-for-service model, we would not have been able to take care of the people during this pandemic. And so if we were more in the value world, I would have thought that we would have even further accelerated our work. And when I say our work, I mean healthcare overall, to be able to continue to make the right decisions without necessarily thinking about, am I going to get paid for this? Am I not going to get paid for this? Should I do this? Should I do that? So what it really does in my mind in terms of going down this idea of value-based care is creating the circumstances under which we can focus on doing what is right for our patients and our community members, knowing that there is a business model that supports it to make that happen. So, if I have to have somebody see a primary care physician more often so that they don't end up in an emergency room or in a hospital bed or have complications from something, that is resources well spent. So when we look at a unit price of primary care, that may have gone up, but when I look at the total cost of care across the system, we can significantly reduce that over a period of time. So those are the kinds of things that I think we need to continue to go down the path of thinking about what are the appropriate types of care, and how do we optimize the care model, and how do we optimize the financial model as well.
Well, Dr. Andrabi, thank you very much. We appreciate you making time today to talk with us.
It's my pleasure, Stephen. Thank you very much. You've asked some really good questions.
Well, I'm trying, so thank you. I'm Stephen Ross Johnson with Modern Healthcare. Please be sure to come back next Monday for the latest edition of The Checkup. Till then, thanks for watching.